Hi, I'm Mel Pickup, Chief Executive of Bradford Teaching Hospitals. The last year has, without doubt, been the hardest in the history of our organisation and indeed the wider NHS. All our staff have experienced the relentless challenges of the COVID-19 pandemic firsthand. It's been an unprecedented year, and I know many of us have been through perhaps the toughest times, both professionally and personally. It's put strains on us in ways that I suspect we never thought possible. Sadly, many people lost their lives to COVID-19, but well over 3,000 patients who were admitted to our hospitals with COVID-19 recovered and were discharged home after surviving this terrible virus. In the face of adversity and, at times, great sadness, we have also witnessed incredible compassion, strength and unity from our colleagues, our partners and our communities. I would like to thank all the businesses, schools, voluntary groups and individuals who have supported our hospital through this crisis. We've received thousands of donations, from hand creams and cooked meals to knitted hearts and even the offer of people's own houses. During the year, Bradford Hospitals Charity received £881,000 in income. £391,000 of this was related directly to COVID-19. And this money has been invested across our charity's 4 funds, and they are Children and Young People, Elderly and Dementia, Cancer and our Sunshine Fund. Money donated to our COVID-19 NHS Hospital Heroes Appeal was invested in support and well-being to help our staff through this crisis, and we also brought equipment to speed up and enhance diagnosis and treatment, as well as items and equipment to support patients affected by COVID-19. Our Raise a Smile appeal aims to make radiology services more child-friendly, and thanks to your donations, imaging rooms in X-ray, ultrasound, CT and MRI have been refurbished to make them more appealing to children and nervous patients. Our big neonatal appeal has seen money invested in improving facilities for families visiting their babies in our neonatal unit. With your help, we've been able to purchase equipment, training, research and fund projects which go over and above what the NHS provides. You can find out more about our charity and how to donate by visiting the link displayed on the screen now. We're grateful for everything that you've done to show your support and solidarity, and we will always be grateful for the kindness and generosity shown by the people of Bradford. Our hospitals are your hospitals, and we will continue to repay you by providing the exceptional treatment and care that you deserve. And what an exceptional year we have had. We are incredibly proud to have played a part in medical and scientific breakthroughs. Our trust was chosen as one of 5 new patient recruitment centres for cutting-edge treatment trials, including for COVID-19. The new research centre, part of a £7 million government investment, has helped people across the region to take part in important commercial clinical research. As a result, we joined the race to find a vaccine, and we rolled out a world-first COVID-19 vaccine trial. Hundreds of people signed up, including many of our own staff and people from across our local community. We also launched a COVID-19 vaccine booster trial to give scientists from around the world a better idea of the protection a booster dose of the vaccine offers. One of our consultants, Professor Alex Brown, became the first in the world to take part in the study and receive a booster vaccine. And in December, an 85-year-old man became one of the first people in Bradford to receive a COVID vaccine, as our trust became a vaccine hospital hub. This marked the start of the district's vaccine programme to protect patients, care home staff and frontline NHS staff. Once again, these developments put our researchers in the spotlight, highlighting their commitment to improving the lives of our patients and our local communities. And you can hear more about this when Professor Dinesh Saralaya makes his keynote speech later. Through our research and involvement in clinical trials, we and the many volunteers from across our local communities have directly contributed to the success of the national vaccination programme, and for that, Bradford should be incredibly proud. The pandemic forced us to rapidly change to new ways of working, and we all had to adapt quickly. From the national lockdown on the 23rd of March last year, so much of what we do had to be transformed virtually overnight. And this was only possible thanks to the commitment and sheer hard work of our people. At the heart of innovation, drive-through services for our cardiac patients became the new normal at St Luke's Hospital. Staff set up the drive-through clinic at the height of the pandemic. It specifically helped vulnerable patients who needed their heartbeat or breathing assessed. and it allowed them to pick up test devices without having ever to leave their car. Bradford had a consistently high number of COVID patients in hospital throughout the year. There was no downtime for our staff, but we consistently kept the job of caring for our patients while still looking forward and transforming services as our priority. And our staff continued to get national recognition for their efforts during the pandemic. Intensive care consultant Dr. Tom Lawton was awarded an MBE for his services to the NHS during the pandemic. Claire Chadwick, nurse consultant, was awarded an MBE for her work in the field of infection prevention and control. And physiotherapist Cordy Gorbert won a Top Health Heroes Award for her outstanding work in the fight against COVID-19. We are committed to working with our local partners in health, social care and the voluntary sector. Working together, we act as one to achieve our vision for the people of Bradford District and Craven. By working together and acting as one, we will improve the care provided to patients and improve the health of people across the district. We join forces with local health and social care services to launch a new digital roadmap for Bradford District and Craven. It will help people to be happy, healthy at home. Called People First, Digital First, it shows how patient care has and will continue to be better and safer delivered through digital technology. Paper appointment letters became a thing of the past as we introduced digital appointment letters for patients. I was proud to launch our plan at the end of the year, which we have called People, Partners and Place. This year has been a year like no other, yet despite the challenges of the pandemic, we have delivered care to be proud of, and we've lived up to our vision of being an outstanding provider of healthcare, research and education, as well as a great place to work. Amid the pressures we are working under, it's vital that we continue to look forward. Our maternity services started their forward journey and launched their landmark 2-year Outstanding Maternity Services programme. It will transform care for the women and families across our district, and it involves every one of our 450 maternity unit staff who care for our mothers and the 5,500 babies born here each year. The new year saw a start of a multi-million-pound building project to improve the obstetric theatres and labour ward facilities at Bradford Royal Infirmary. This is part of more than £30 million worth of improvements and ward refurbishments for the benefits of patients that we are seeking to deliver this year. The spirit our people have shown in coming together and working as one to rise to the challenges that we've faced has been truly inspiring. A fact acknowledged by the many thousands of you who took to their own doorsteps in their own local communities to applaud in appreciation for everything key workers did to keep our district safe. But it's not just through clapping that our communities have supported us. We are immensely grateful for the sacrifices people have made and continue to make to protect our services for those most in need. Thank you.